Hello, my name is Shaz. I'm the CHAMP project coordinator at ASAAP. I work with the support team and we offer services and support to people living with, affected by, and at risk of HIV and AIDS. We also provide services to LGBTQ plus populations that are South Asian, Middle Eastern, and Indo-Caribbean. The barriers faced by LGBTQ plus populations are far and wide. One example involved a medical appointment that one of our service users and his doctor had. This happened a few years ago when the service user was considered a teenager. The doctor knew this teen very well, and vice versa. They had a pretty good relationship, for the past several years. And so the teen decided that now was the time for him to be out about his trans identity, because he needed some medical treatment and care, and he felt he could trust the doctor to preserve his privacy, because he felt that his parents would not understand completely the change at that time. So he wanted to wait to inform them a little bit later. But with his doctor, he needed to inform her of the change because he needed referrals. But as soon as he told his doctor, he told his pronouns, his name, the fact that he couldn't live in his body, in that body, the doctor was visibly shocked. So the doctor asked, the patient, did he inform his parents? And it's kind of important to say that, the doctor did not refer to the patient as he, him, or by his name, by the name that the patient chose for himself. And the doctor just used the pronouns she, her, and the name that the doctor was used to. So that, that made the patient, very uncomfortable. And the doctor also, informed the patient. It wasn't like it was kind of like a threat, I guess, but he informed the patient that either the doctor would inform his parents or the patient would need to inform his parents before any changes, like any treatment of any kind, could be given to the patient. So the incident happened in Ontario, and the doctor could have, done a number of things. One, referred to the patient, as he, him, used the chosen name by the patient, reassured the patient that their privacy and confidentiality would be respected, and also informed the patient about Ontario's Healthcare Consent Act that may provide some, additional rights for the patient when it comes to consent and, if they are minors. In this case, the patient was a minor, and the patient did seem that, they knew what they were doing, when they voiced their needs to the doctor, it was clear that the patient had done the research. So those were some things that the doctor could have done to make their patient feel comfortable and safe.